Hello, my name is Emily Boucher, and today we're going to be talking a little bit about hazardous medication handling and administration, as well as proper waste procedures. This is a very important topic, regardless of what field of nursing you go into, because even if you're not necessarily going to be handling chemotherapy, we all handle hazardous medication or hazardous waste potentially every day in nursing. So this is important information to know so you can safely protect yourself from any sort of exposure. So the learning objectives for this presentation are as follows. After this presentation, the learner will be able to identify what is a hazardous medication, review levels of PPE required, review supplies needed for administering hazardous medications, demonstrate a safe hazardous medication administration, review proper disposal of hazardous medication and hazardous waste, and review what to do in case of a hazardous medication spill. So starting off, what is a hazardous drug? According to the National Institute for Occupational Safety and Health, or NIOSH, hazardous drugs are drugs that have been proven to cause one or more of the following. So carcinogenicity, teratogenicity, or any other developmental toxicity, reproductive toxicity, organ toxicity, or genotoxicity. So NIOSH puts forth a hazardous drug list. This is updated at minimum every 2 years, as well as kind of an as needed basis if there's new drugs that need to be put on the list. And this is the best place to look to determine if a drug is hazardous or not. So several entities have put forth guidelines or standards for handling hazardous medications and their waste, but none of them were ever enforceable. That is until USP 800. So USP 800 were standards for handling hazardous medications and their waste that were put forth by the US Pharmacopeal Convention. These standards talk about things like waste procedures, PPE requirements, things like that. They are enforced by each state's Board of Pharmacy, their delegated agency, and or the U.S. Food and Drug Administration. And these standards needed to be in place, and healthcare entities needed to be compliant by December 1st, 2019. And this was the first time that a pharmacy-centric organization was actually directing nursing practice and will be monitored and enforced. So we can determine if a medication is hazardous based off of the different levels that it can be classified under. We split these levels up for parenteral versus non-parenteral medications. So starting off with parenteral medications, these are medications that are IV, intramuscular, subcutaneous, things like that. So these are split into two levels. The first is level 1, which have a moderate or high potential to be hazardous and do require the use of PPE, as well as, if possible, a closed system transfer device. And level 2 are those agents that have a low potential to be hazardous, so they don't require any sort of PPE. Non-parenteral agents are things like oral medications or topical medications, and they are split into 3 different levels. So starting off, we have level 1A. These are agents that may have teratogenic or cytotoxic risks, and they do require the use of PPE. So typically, we just wear our chemotherapy gloves. Level 1B agents may have teratogenic or cytotoxic risks. However, they do not require PPE unless there is a reasonable risk of skin exposure. And then finally, level 2, these agents have a low potential to be hazardous, so they do not require the use of any PPE. So what exactly is our PPE? So starting off, we have our chemotherapy gown. This is a little bit different than our standard gown that we would think of like for a contact isolation room. These gowns are plastic backed, so they are pretty impenetrable. I've actually worn one of these in a pinch in a rainstorm walking to my car after work and was bone dry when I got to my car. So no fluid can get through them. They also have tight cuffs at the end of the sleeves to help protect the wrist area. And then we have our chemo gloves. These gloves are a little bit different from our typical gloves. They have this extended cuff at the end of them. So we will put on one pair and extend it like all the way kind of up our wrist. Then we put on our gown, and then we'll put on a second pair of these gloves, again, covering that the whole wrist and covering the cuff of the gown. So then nothing can get through from our hands or our wrists. And then if we are doing something that has a reasonable risk of splashing, so for example, if we're like emptying a urinal, then we would wear face shield and goggles. After a patient has received a hazardous medication, their body fluids are actually also considered hazardous for 48 hours after the last dose, because that medication is excreted through the body fluids. We also use what's called a closed system transfer device, and that is required when administering a hazardous drug if the route allows. So always when we're administering an IV one, makes up two different pieces. The definition of one of these devices is any device that prohibits the transfer of environmental contaminants into the system and the escape of hazardous drug or vapor concentrations outside the system. So it's made up of two parts, like I said before. We have our male Luer lock adapter. This is what attaches to the patient's IV line. And then we have the closed system device itself. Nothing can flow through either of these parts until they are snapped together, and then fluid can flow through. So no matter if I had an IV bag connected to this and that line was wide open, it will never flow through this piece until it is connected to its adapter. We also administer these medications a little bit differently than we would just any standard IV medication. So if we draw our attention first to the image all the way on the right, we can see that the tubing has about 26 mLs in it. So these medications come to us primed by pharmacy. Usually they have to be primed under a hood to allow for, particles to safely disperse. So they'll come up primed already with a closed system device on the very end of that tubing. Those, the tubing lines are only one-time use. When that drug is done infusing, we're going to fully dispose of that whole set. So we could potentially, thinking that these medications, that 26 mLs in the line, if we're thinking about a medication that could only be 100 mLs total, or even just 50 mLs, we could potentially lose a half or a quarter of that drug just in the line itself. So we need to flush it through. To do that, we use what's called 3-port tubing. So your typical IV tubing will have a port up above the pump where you can attach your secondary set to, like if you're doing an IV antibiotic. And it will also have a Y site down all the way almost at the end of the tubing. 3-port tubing has this additional port right here, just under the pump itself. This is where we can attach our flush bag to. So our flush bag will be 50 cc's of a compatible solution, typically normal saline, and we'll prime that on short tubing or secondary tubing and attach it to that third pump that's underneath the or third port that's directly underneath that pump. Then we will infuse the medication, and we want that line to go dry all the way down to just below the pump. When that tubing is all dry, we'll turn the pump off and open the roller clamp on our flush bag setup, and then allow that to flush in through gravity to get the remaining drug into the patient's system. Then when all of that is done and we're ready to disconnect, we actually will take another closed system device and attach it to our saline flush, and then use this to flush our patient's line. We'll disconnect the IV tubing just at the closed system, and then attach our flush to our patient's Luer lock adapter, flush through, and then we can take this whole thing off the patient's IV. And then that way, any remaining hazardous drug that could have been in the line is now in their system, and there's only saline in the line. We do need to dispose of these medications in a different way from how we normally would dispose of medications. So we use two separate bins. First, we have our black RCRA bin for our hazardous waste, and then we have a yellow bin for our non-hazardous chemo waste. So into the black bin, we'll put things like a full bag of chemotherapy, any materials from a spill cleanup. If we had a patient on oral chemo and they dropped their pill on the floor accidentally and we had to dispose of it, we would also put that in the black bin. And then the yellow bin will hold our non-hazardous chemo waste, or what we call trace hazardous waste. So this is anything that contains 3% or less of that drug itself. So things like our PPE, when we're done hanging that drug, we'll take our PPE off and we can put it in that yellow bin. We would also put empty chemo bags and tubing in this bin, as well as any linens that are contaminated with the hazardous medication, or again, soiled with the patient's body fluids, because like we said before, those body fluids do have trace amounts of that hazardous drug in them. So what if a spill occurs? This is typically a rare occurrence, but it can happen. So when you have a patient that is receiving one of these types of medications, you want to make sure that you have a spill kit nearby and easily accessible, just in case. First step is to clear the immediate area as well as obtain the spill kit. We want to make sure that our patient is safe, as well as kind of removing anybody who's non-essential to the situation to minimize the risk of somebody coming into contact with that medication. Next, we're going to remove the contents from our spill kit and don our PPE. So we're going to wear a gown, 2 pairs of chemo gloves, goggles because there is a splash risk. A lot of times the kit will come with booties to protect our shoes. And then we want to wear an N95 as well. And we want to make sure that this N95, we're not just taking the one from the kit. We want to make sure that we're using one that we have been fit tested for. Next, we're going to use the spill pads that are supplied in the kit, and we are going to contain the spill. A lot of these kits will have pads that when they're placed onto a liquid, they'll turn into kind of like a gel substance so that it's a lot easier to scoop up and dispose of. We'll place all of the used pads in the provided disposal bag, and then we'll use a detergent to deactivate any remaining spilled chemo, and then just rinse with plain water. Next, we're going to place all of our PPE and any materials that were used to clean up the spill in the provided disposal bag. We'll close up that disposal bag, tie it up, and place that bag in our black RCRA bin. So we do need to provide some patient and family education for safety reasons when these patients go home. So like we said before, the body gets rid of hazardous medications through the body fluids. So urine, stool, vomit, blood, anything, while they're receiving the medication and for 48 hours after the last dose. So we could have a patient that goes home the day that they finish their last dose. They could go home the day after and still have these medications in their body system. They could be in the infusion center and go home 20 minutes after their dose. So we really want to make sure that we do everything we can to educate them to keep their family members safe and not have accidental exposures. So first off, the patient should try to use a separate bathroom if possible. If it's not possible, then they should wipe down the toilet in between uses to try to remove any possible residue that could be there. We want to make sure that they're flushing twice and with the lid down to minimize any risk of particles getting into the air. If for our male patients, we want to tell them to sit down when they pee to minimize splash risk. And we want them to make sure that children and pets don't play around the toilet, that we don't have pets drinking from the toilet, because they could potentially have exposures and have these risks as well. Caregivers should wear gloves if they're handling any oral hazardous medications. And we want to make sure that women and pregnant women and children do not handle these medications. Any empty pill bottles that we're holding, like an oral chemo, should not be recycled, and they should not be used to store other medications because there will be residue inside of that container. And we don't want that getting onto any other medications. And any items that were soiled with body fluids should be kept in a plastic bag until washed, and they should be washed separately from other laundry. Again, so that there's no cross-contamination with that. And here are my references for today's presentation. Thank you for your time.